Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by a Tale 2 hygienist in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had. Hi everyone, Tom Viola here with Pharmacology Declassified, and yet another Fast Facts Pharmacology Edition. Well, we're continuing our research into the drugs used for treating central nervous system disorders, central nervous system pharmacology. And now we're going to talk about the drugs that are most commonly referred to as antidepressant agents, but really they're also used as anti-anxiety agents. They come in a wide variety of types. So we've got, for example, those drugs that inhibit the reuptake of norepinephrine and serotonin. They would be classes of drugs like the tricyclic antidepressants, of which amitriptyline or Elavil was the most common, and even drugs like venlafaxine, Effexor, which were serotonin norepinephrine reuptake inhibitors. The drugs we're probably most likely to see are most commonly associated with antidepressant agents would be the SSRIs, the selective serotonin reuptake inhibitors. Drugs like, Lexapro, escitalopram, and Zoloft, sertraline, and Prozac, fluoxetine. They inhibit the reuptake of serotonin and boost serotonin in the brain. But there's still a few more. There are drugs that inhibit the reuptake of norepinephrine and dopamine in the brain. That would be a drug like Wellbutrin or bupropion, which was used actually in dentistry as a tool for smoking cessation. Now, for the most part, it's been replaced by Chantix. And in addition to that, we've got a drug called trazodone or Deserel, which is a serotonin antagonist and reuptake inhibitor. Now, serotonin antagonist reuptake inhibitor doesn't sound like it fits in the world of insomnia, but Deserel has been used quite successfully in managing insomnia in some patients. We actually have MAOI that's still available, monoamine oxidase inhibitor called MSAM, selegiline. And here's a tongue twister for you, a drug that inhibits both histamine 1, alpha 2, and serotonin 5-HT23 receptors, also known as the tetracyclic antidepressants, of which mirtazapine or Remeron is the lucky member. So you have all of those drugs that are useful in treating depression and or anxiety. Tell us, Tom, what type of adverse effects can we expect? Well, everything from central nervous system depression to stimulation, depending on the drug. But one thing they all have in common is xerostomia. And a lot of them cause what we tend to call bruxism, or really clenching. Okay, so that means, TMJ issues, myofascial banding, overdeveloped masseters, fractures, vertical fractures, cusp fractures, crown fractures, xerostomia, appliances. Yeah, you get it. And in addition to that, the unfortunate side of many of these drugs is the fact that they increase potential for suicidal ideation, which again, I've often said to my students and the people who attend my lectures, be the bartender. Patients who think suicidal thoughts may not tell their clergy person, doctor, nurse, physician's assistant, but they might tell a medical professional who's easy to talk to and who's approachable just what they're really thinking. And then maybe you. So think. What were those words again? Listen. And then speak. Give them the suicide prevention hotline number. Give them words of encouragement. Show them compassion. Who knows? You might just save a life. Thanks again for your attention, my friends. This is yet another Fast Facts Pharmacology Edition. Tune in again next time, where we cover even more drugs on central nervous system pharmacology. Till then, be well. Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care, creators of the innovative and proven prevention-focused oral care products from Advantage Arrest Silver Diamine Fluoride to Fluoramax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Fact.